Hi, my name is Kira. I'm going to be your nurse today. I'm going to provide some privacy and wash my hands. Can you confirm your name and date of birth for me?
Michaela Berry, 2/17/06.
And then do you know where you are and why you're here?
At the doctor's office for a checkup.
Okay, first I'm just going to observe your chest, look for symmetry, make sure you're not using accessory muscles when breathing, look for discoloration. And then I'm going to check your fingers for clubbing and capillary refill. Okay. And then, do you have any trouble breathing?
No.
Do you have any recent surgeries?
No.
Any shortness of breath?
No.
Chest pain?
No.
Okay, I'm going to palpate your chest. Just let me know if you feel any tenderness. Any tenderness?
No.
Alright, I'm going to listen. Just take a breath each time you feel my stethoscope. Okay, sounds good. I'm going to do your back. If you could face that way, I'm going to observe your back again, and then I'm going to palpate again, so just let me know if you feel any tenderness again. Any tenderness?
No.
Okay, just take a breath each time you feel my stethoscope. Okay, and then just take a deep breath in and out. One more time. Okay, that's it for your respiratory assessment. If you could just lay down for me and we'll start your abdominal assessment. And then I'm just going to have to expose a small area of your stomach. And then have you have any changes in appetite, anything like that?
No.
Any stomach discomfort?
No.
Okay. So first I'm just going to observe, make sure there's no distension. I'm going to look for hair distribution, see if there's any discoloration. There's no lesions or scars. Her umbilicus is normal. First, I'm going to just listen. And then I'm going to listen for any bruits. Okay, sounds good. I'm going to do some light palpation. Any pain with this?
No.
Okay, there's no bulges or masses. I'm just going to feel for her abdominal organs. Okay, and then I'm going to check for a hernia. So I'm going to put some pressure. If you could just lift your head up for me. Okay, same thing on this side. Just lift your head up. Okay, perfect. So everything looks good on that. You don't have any other problems with digestion or anything like that?
No.
Okay, so that's it for your abdominal assessment. If you would like to sit up, and we'll do your neurological assessment. So I'm going to have you remember a phrase. I'm going to tell you a phrase and you're going to have to remember at the end. So we're going to do pencil, homework, and school.
Okay.
And then can you tell me something about maybe from your childhood, like your first pet or something like that?
I had a dog. Her name was Macy. She was a back lab.
And then are you in school right now?
Yes, I go to Westchester.
Do you work out or anything like that?
Yeah, I work out.
Do you have anything exciting going on?
Me and my roommates just adopted a dog.
Okay, that's fun. So my client's mood is appropriate, her hygiene and appearance is appropriate. So what I'm going to have you do is, can you stand up for me? Alright, and then just take a few steps towards me. And then walk back heel to toe. And then walk back towards me on your toes. And then walk back on your heels. Perfect. Okay, I'm going to test your balance, so stand towards me. Put your feet together and your hands at your side, and then just close your eyes for a few seconds. Okay, perfect. Now I'm going to test your upper and lower extremity coordination. So what I'm going to have you do is focus on my finger, and then you're going to touch your finger to your nose and then to my finger. So I'm going to move it, and then you're going to keep doing that. So touch your nose and then touch my finger. Okay, and then for your lower extremities, what I'm going to have you do is rub your heel up and down your shin. And then same for the other side. Perfect. And then you can sit back down. We're going to test your muscle strength. So I'm going to push down on your shoulders and push up. Push back on your arms. Push forward. Push down. Push up. Push your fingers up. Down. And then squeeze my hand. Okay. Push down on my hands. Push up. Hold back. And then push forward. And then push up on my fingers. Push down. Okay. So that looks good. Now we're going to test your sensation. So whenever you feel the dull, just say dull. I'm going to go up and down your arms and your legs.
Dull, 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 dull. Sharp, 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 sharp.
Okay, now we're going to test your reflexes. So just relax your arm. Now we're going to do the other side. And then just back up a little bit so that your knees kind of hang off the bed. And then do you remember that phrase from the beginning?
School homework pencil.
Okay, perfect. And then that's it for our assessment.